Okay, hello everybody, and welcome to another episode of Dental Operations Unpacked. Clint and I are very excited today to have a new friend of ours joining us. This is Christin Lisenby. Had to double check the last name there. We just met her, and she has been so kind to jump on here and bring us an intriguing and new perspective to something that we have talked about before, but we're really excited to learn from her. Christin, thank you so much for joining us. We are thrilled to have you today.
Yes, thank you for having me. Excited to be here.
Christin is joining us from Dental Care Alliance from the DCA. She's been there for a couple years now, almost 2 years, but she's been in the multi-site group dentistry space for a while. So before we jump into our topic today and share that, I want to give Christin just a quick opportunity to introduce herself, share with us a little bit about her background. We love to ask people how they got started in dentistry. We find those stories are really fun, and then how you got to where you are today.
Yeah, so I have a long history, 27 years in the dental space, probably my only job ever. Started as a dental assistant, then became passionate about dentistry. It really started in high school in the dental space. I know a lot of people have probably started there, but loved my hygienist that I worked with at that location and decided I wanted to be a hygienist. So I went through the hygiene program as I worked as a dental assistant. So I definitely had a lot going on being a young mom and having a child at the same time and husband to take care of. But all that hard work paid off. I was a dental hygienist for about 10 years before Northcutt Dental, which is where I worked for the 22-year stint, asked me to step into an office manager role. And I wasn't sure about that because I loved providing care, but I also loved helping the whole office. So I did step into that role, and within 6 months, I was building a 22-op practice and acquiring a 12-op practice in my first year of office management. So again,
Wow.
About 10 years into dentistry, but it was all clinical. And then I got thrown into operations. So with 3 locations within my second year of leading, I had to learn a lot. I lost my bookkeeper because she couldn't handle that kind of volume. So I learned how to do the books. I can't say there wasn't a lot of tears along that little path, but it developed me and helped me to see trends and understand not just the clinical side of the business, but also the business and, the overall leadership side of dentistry. And that's truly, I think, where I found my passion is once I found all of dentistry and not just dental assisting and not just hygiene. I loved all of those, paths along the way, but the comprehensive side of the business and helping people trip over the truth of things that just aren't that challenging that we make a little harder than they need to be.
Christin, I think that's the fastest learning curve I've heard of all the guests that we've had on here. Can you imagine just being like, okay, we're going to make you an office manager. And now it's like, and now you have all these locations. Like,
Yeah.
what?
The word that came to mind.
Big locations. 22-op practice was built. I found the property and everything, built it from the ground up. Yeah.
You used the word thrown into it. That was exactly what I was thinking. You just literally were thrown into it.
Yes. So from there, I'll finish my story because that's just the first 22 years of my career. I went from dental assistants, plunging toilets, all the way to president and COO of Northcutt Dental, built multi-site locations. We ended up with 6. By the time I left, I expanded hours while I was there from regular business hours to Monday through Saturday. So I had done everything I possibly could do through the scope of Northcutt, and it was a very well-oiled machine and had great culture, patient care, and great profitability by the time I left. And I was ultimately discovered by Lightwave Dental, who wanted to buy our group. We did not want to sell. We were in no need to sell our DSO. And they ended up giving me an offer I couldn't walk away from. So I joined them as a VP of Field Operations. It's 90 locations. I was supporting about 50 of their fully supported locations at that time, and brought some of the tools that I had used for success in my previous experience. But I also learned a ton about the DSO space and private equity and how to gain the buy-in of lots of different partners. So once again, thrown to the wolves a little bit, but in a 2.5-year period working with them, I felt like I really had learned so much and had seen a lot of results while I was there as well.
I had no idea, Christin. We are very lucky to have you on here. And that's one of the things we were really excited about was she brings a super unique perspective because she spent a lot of time on the clinical side learning that part of it, but then has a ton of experience on the operations side. And we talked to a lot of operators, many of which have been on the operations side for the entirety of their career. But I think that what people will find Christin's experience fascinating and how her insights from the clinical side are translating and have helped her on the operations side. So
yes, and then I'll finally say that I'm at Dental Care Alliance. I'm serving as VP of Hygiene now. My hygiene background caught up to me in this group that needed someone that really didn't just know hygiene, but knew the operations of hygiene, because they really didn't have any infrastructure for support for our 1,000 hygienists when I joined. And in that short amount of time, I've added 18 regional hygiene coaches that are all directly supporting our hygiene providers, impacting hiring, onboarding, retention, merit, ultimately taking care of our patients, but it's providing that support for that group of people that we really can't do business without. We kind of underestimate just how valuable hygiene is in the dental space, and that's what I'm enjoying so much, is that I have a direct impact on loving on those people that are the reason for our success every day.
And that's what we get to talk about today, is hygiene and the impact that it has on the organization as a whole. The topic for today is true hygiene value, the KPIs that actually drive a healthy P&L. And Christin has some awesome insights and things that she has implemented and seen across multiple organizations and multiple offices to demonstrate how this is so powerful. So let's dive in. Should we just start with understanding what true hygiene value is? Do you think that's a good place to start, Christin, or what would you recommend? What's the best way to start this?
Yeah, so I can definitely start with true hygiene value is not really necessarily a KPI, I wouldn't say. I would say it just helps us value every patient visit, hygiene visit that comes through the practice. It's a really easy equation, and I know as operators, we all want something to latch onto to kind of see if we're doing better or worse. And by studying this and utilizing it in all of my roles, even in the hygiene role that I'm in now, we've got this as a part of our hygiene coach awareness and helping operators to understand the true value of hygiene. It's the total production of the office, adjusted production, divided by total number of hygiene exams, to include comprehensive exams. So you take those, 2 or 3 exam codes out of hygiene, and you take all of the adjusted production. If you divide that, that's going to give you a number. The number that's the benchmark for that is $450. And why is it $450? On average, a typically healthy practice produces out of hygiene $450 when you take into account all of the care that's provided on the doctor's side as well. The hygiene visit on average across multiple areas is about $150, right? Some groups do more, some groups do a little less depending on insurance. But I found that number of $150 in hygiene and about $300 on average to equal $450 being the baseline of healthy or unhealthy. So once you know that number and you start looking at how many hygiene visits, how many hygienists, and then how many visits you have, you can start to figure out just where you're going to end up in your P&L and your productivity based on visits seen. So if you're wanting to grow, or you're wanting a doctor is wanting to improve in their career, you can look at that number and help them determine just how many visits they need to see to increase the care and their take home. This isn't necessarily a number for hygienists, right? The hygienists are the ones that are the filter for the care to go through the practice. They provide the preventative care, and then they set the doctor up for the treatment. So again, this is just a comprehensive view that I think once you understand this, someone at the front desk doesn't really know the value of that hygiene visit that just canceled and filling it. Someone at the front desk that's not confirming appointments or shuts down a whole hygiene schedule for the day because they don't understand the value of what they just did to the entire practice, it starts to create awareness and buy-in like I've never seen before. Bonusing. I never really bonused my teams on production because they never knew how to really control that. I knew what the true hygiene value number was. I knew exactly how many hygiene visits and even calculated no-shows and cancellation rates in there. And I could tell them exactly how many hygiene visits on average they needed to hit bonus, and it worked. So all of a sudden, nobody cared about the production anymore. They only cared about keeping hygiene flowing. Another great example I'll give it is as a hygienist is where I probably really started to identify just how much this impacted our schedule. I was a production hygienist, so when my schedule started to get light, we noticed that in a few weeks, the doctor's schedule started to get light. Around Christmas or holidays when we were shut down, there was always a lag time, but it always showed up in the doctor's schedule when I wasn't providing the exams to flow into the schedule. So I think it's a metric that I find to be, if you could look at any metric, it's the number one thing that I can tell you almost immediately what's wrong. If that number is too low, then we have a diagnosis problem, treatment acceptance. Maybe we need to offer financing. Maybe we're referring too much out. If it's high, then we don't have to see as many visits. We can focus, on maybe slowing down and giving a little bit, less volume care and more comprehensive and, niche care. So I'll pause there because I threw a lot at you, but I was trying to paint the bigger picture of the value of this metric and how just valuable it could be.
I like this. I think what this does is it takes a lot of a little bit more complex KPIs and makes it a little bit easy to understand. And when you're describing it, it really resonates because then you're like, oh yeah, duh. If you knew how much a hygiene appointment was actually worth, then that really can dictate, it really lines up with what the revenue is going to be per hygiene. That makes complete sense.
And the doctor's pay, right?
Yeah, and
forget the P&L. The doctor wants to be $100,000 producer because they went to school and they should be able to produce, that kind of care. But they have to have so many visits for that to be achievable. That's why so many doctors starve because they don't have enough hygiene. They don't even know what the problem is.
Clint and I come from a software background. I've said that before. And so I've always seen hygiene as like that top of funnel revenue driver, right? And I love how what you've designed here is a super simple, easy to understand, like red flag or like warning sign. It's identifying those leading indicators where you can actually fix things before it becomes an issue. And people work better when things are simple. When things are complex, we always say the confused mind says no, or we shut down. But if it's simple and I just have one driving North Star that I can focus on, and that impacts all the smaller KPIs underneath it, it just simplifies the collective vision of, okay, what do we need to focus on? And then I love what you said, like if it's low, then you can dig deeper and identify which other KPIs inside of it are low. But if it's high, I just like the simplicity of it. I think that's really, really brilliant.
Exactly. And it's helped me bridge the operation. I want to go back to that. It's helped me bridge that operational mind that has no idea what it takes to provide that clinical care. It's helped bridge that gap so that we see how we all work together. Hygienists don't see patients without the phones, having good phones and patients getting onto the schedule, right? And good retention and reactivation of patients. And the hygienist keeping their chairs filled is access to care for patients who need it. We have millions of patients that need to get in the door. So if we are all focused on making sure their chairs are full, then the doctors will have plenty, just because we have so much dentistry out there, they'll have plenty to do. But it starts with making sure our entire group is focused on hygiene capacity.
Do you see differences in, like, since you've worked at many multi-locations practices, like, are there some regions where it's like, oh, this region takes care of their teeth better, so that true value is just going to be a little bit lower, right? Because they're going to get their cleaning and there's no cavities, there's no work to be done. Does that happen like from region to region, or do you find that mostly on average across the states that it's pretty similar?
I'd say there's always a good mix. It really depends on the doctor's skill set too, on how much they're referring out. Doctors that are keeping endo in-house and doing ortho, they are going to have a higher true hygiene value number because we're not sending it somewhere else. But that's where that 450 being the bare minimum is kind of like your everyday, just out of school dentist doing, two hygienists worth of work. I think it's interesting, and this might be a little too deep, but that $450 on a day where a hygienist calls out and we just close the schedule and we freak out about hiring a temp. Well, if you look at it at $450 a day times 7 appointments, let's give the one missed appointment. That's about $3,000 to $3,500 for that day. So you start to think about, it was probably worth keeping that chair open for access to care for the doctor to be able to check the patients and get them in. And then another thing I've noticed is we like for doctors, on average, we find that doctors averaging about $3,500 a day is kind of the norm in dentistry for everything to win in the P&L. If $3,500 is the answer, and I know that we have about a 50% acceptance rate, 2 hygienists, $3,500 a day, that's $7,000 divided by 50%, that's $3,500. So it really, once you understand it, if you like math, I probably just blew somebody's mind, but that's just how easy it is to understand the value of what I'm sharing and the basic, again, not high performers, just basic everyday blocking and tackling in the dental office. That's the goal.
Yeah, I feel like it would create buy-in. Like, you're outlining these numbers and how it's going to impact. A simple decision can impact the production for that day. I wonder if people without this, have any idea of the actual impact that decision makes, whereas this just makes it so cut and dry, like, this. And so now they can run in the same direction as you are as a leader, which is my next question. And I think it kind of speaks for itself with a lot of things that you've said, but I'm curious, how do you find that this creates buy-in and alignment throughout leadership inside of an organization? What have you seen as far as the impact this goes of creating that across all the different operational pieces in a multi-site group or even in just a single location?
Yeah, so I find that operators are a little scared of clinical leaders or clinicians in general because it's not a world that they know, and they definitely do not want to be perceived as telling them or talking about the numbers. So by using this where everybody agrees, this is just an average for our scorecard for the office based on the care we're providing. And in a way that the doctor feels like, this is, they're not telling me I'm bad. They're just telling me what our number is. And then how many visits does it take for us to be successful? So again, I never beat a doctor over the head with their number. It's more awareness. And then the awareness drives change. And that's how I found that operators can bridge that communication gap with clinicians in a way that's not looking at KPIs that doctors don't understand. This is super simple math, and it ultimately impacts their take-home pay. Where I see that this speaks the loudest to operators is that day we talked about where we decide that temp was too expensive, so we're going to shut down hygiene. They see it in their EBITDA. They can't understand it, and when they're looking on the other side of it, they're like, man, that month really didn't perform well. If you just look back at the amount of hygiene visits, it's probably going to tell you that story, and you're going to see why you paid the bills, but your EBITDA tanked, because we're that close from those decisions impacting month over month profitability for the practice.
That's super fascinating. I love this, and I love the simple model. That makes it so much easier to reason about. Jake, I want to make sure, I know we don't have too much time, but I really want to hear what operators can do differently. I know we talked, that section was on the agenda a little bit, Christin. So if you can kind of talk a little bit about that, I think that could be super beneficial to hear.
Yeah. So I think if I tie it all into true hygiene value and why I'm passionate about it, I think I definitely shared that. What I'm using this for now through my hygiene coaches is we do track this metric. It comes through our analytics team, so we know every office's true hygiene value. And when our hygiene coaches are working with hygienists, they're also talking to the front desk and the operators and helping them to understand that every hole in hygiene is costing about this much. It's not just a $150 hygiene visit. So it's trying to gain the buy-in of the people that are confirming our appointments or not filling our schedules fast enough, because that's where we tend to feel like we don't have a lot of control, right? We can talk about, best practices in hygiene care all day long, but if we don't have the team making sure that we're at capacity and why it's so important, then we're just going to be mediocre. So I think that's how we're gaining the buy-in. And then through operators, again, it's a simple math equation: adjusted production divided by those exam codes, comp exams included. We don't count emergencies in that because that's not a consistent, flow. But adjusted production divided by that. And then once you have that number, starting to talk about the value of every hygiene visit and why that matters. If you can tie bonuses around it, let's watch our numbers. Let's see if 200,000 is our number this month and that takes X amount of hygiene visits. Let's watch to see how this works and do it as a team. Start to identify that as a team, and then you'll have people wanting to keep the schedules full instead of beating them over the head with, why aren't you confirming? Why aren't you, it works so much better when they have like this awareness that comes about them. And it's truly been the secret, I think, to my success in leadership is getting the buy-in. I'm always looking to figure out the best way to get what's in it for the person, so that they want to do it instead of having to do it.
I love it. I love it so much. Something that's interesting, and I'd love your perspective on this, since this is like your expertise, especially now since you're over hygiene. Every dental show I ever go to, and we'll always ask doctors, hey, like what are your biggest problems you're dealing with? I think every show, every doctor has mentioned we have a hard time hiring hygiene and keeping staff. Like it's super hard. Like, do you have any recommendations on that? And it can even just be broader from the ecosystem. Do we need more hygiene schools, or do we need to incentivize? Or maybe it's just at the office side where it's like you need to be better to get better people. I don't know.
Yeah. I'm pretty passionate about that as well. The last study I heard was we're graduating 1 doctor to 1 hygiene ratio. I don't know if that's still the accurate, but when I was in my previous role, that was the number. And we all know 1 doctor to 2 hygiene ratio is the answer for success. So we're all fighting for a pool that is not growing at the same rate, which is causing those, higher rates of increase. I don't mind paying more for a hygienist when I know their true hygiene value, because we can't do anything for the practice if we don't have visits. So for me, are we really going to fight over $1 or $2? I like to show doctors the other side of the coin on not having that hygienist and what that would impact through true hygiene value at a grander scale, and their pay. You can shut that down, but are you ready to take X amount of pay cut per month, because that's on average how many visits lost? It gets people motivated, and they're ready to pay that extra $2 to have that filled, or they respect their hygienist more and they want to treat them well. They value them. It really is that simple. I think it's a lack of value for what they truly bring to dentistry.
I can hear all the hygienists right now are getting on LinkedIn and they're reaching out to Christin saying, hey, we want to come work for you. You value us and you'll pay us more.
And I do. I pay hygienists a very nice base pay, and then or production, a % of their production, because I want them to be rewarded for the care they provide so that they truly are in control of their own destiny with pay. And then I teach that as well and help them understand how to calculate their average per hour in production. So I do feel like we have a really good system to get hygienists also bought in and excited about providing care and being rewarded for it.
Awesome. How have you measured patient satisfaction in the past? Is that something that factors into this as well? Because obviously you don't want it to just be like a factory where like, we need to get as many cleanings done as possible. But
and I love that you said that, because it might be perceived that that's what I'm saying is just a prophy mill, and that's obviously not what I believe in. I want patients to have the best care, preventative options, templating for those SRP appointments. We can do all of those things and incentivize hygienist to provide best care so that she's rewarded, and then also incentivize the team to pay attention to visits so that they're rewarded. So everybody wins in that scenario instead of just, keeping a constant churn. Now, I'm sure there are some that would abuse that once they know that number and then just cram them everywhere you can. I can't necessarily speak to how that would look as a culture, right? My ultimate goal is for the culture to be good so that the patient care is excellent.
But I see the opposite, Clint, that the patient satisfaction would show itself in a higher in the wherever your true hygiene value is, right? Because if the satisfaction is good, they're going to complete their case acceptance is going to go up. The additional everything that's going to drive that number up would also indicate that their satisfaction is good. So if you have a high volume of hygiene appointments, but the true hygiene value is low, then I think that would be an indicator that the satisfaction is bad. So I do think that
you got it.
Yeah, I think that what Christin has done, that's the beauty of it, is that it does simplifies all of the additional stories happening behind the scenes. It captures all of it in one number that tells that story. Now, at the very beginning, I think it was before we jumped on, Christin, I asked you about it, and I was like, why do you bring all the other production components into this number? Why is it not just hygiene based? But now that we've gotten into it and you've explained it, you can see why, right? It helps tell that whole story in a single number. So anyway, that was as you were asking that, I was like, well, yeah, I mean, it's in the same number here.
I like it. I like it a lot. And it's interesting to see that in other industries, it's the same way. You think things that are like mutually exclusive can't happen, where it's like, can we provide quality care and still get a lot of visits? And the answer is like undoubtedly yes, right? In software, it's always like, can you get fast and deploy quickly and still have high quality software? And the answer is yes. In fact, they're not mutually exclusive, but it has to be done right. Culture is a huge part of it. And yeah, I just really appreciate it, Christin. This is super valuable. So I appreciate you.
Yeah, no, thank you for allowing me to share my passion. Obviously, you can tell I'm passionate about this because I do feel like it takes a lot of the complicated out and really simplifies the work that we're trying to do as operators and clinical leaders. So I just hope that it helps another operator out there. And if they ever need, to ask a question, I'm happy to support. I'm standing, on a bunch of giants before me that helped me trip over the truth of these really simple ideas. I just had the ability to execute and put them into action and then see the fruit of them. So I think that's where my passion really lies.
Well, Clint and I are sold on it. We're going to embed this in part of our data warehousing tool to be like a pre-templated number that we can give people.
I know. I was already thinking that. I'm like, oh, we could add this number. This number needs to be on the dashboards. So
it would make me so happy to see true hygiene value become a metric like PPV and all the different, all the different KPIs that we track. To me, THV is what is the acronym for it, is the best one to track. So
can we just call it the Christin number? Is that okay?
Sure. Yeah, I don't mind that.
So awesome. Well, Christin, thank you so much for joining us. We hope that other operators listening to this have found this insightful, educational, and that there's things that can be taken away to go implement today to make your practice better, to serve patients more and provide the best care possible. So Christin, thank you so much for joining us. We really appreciate you today.
Yeah, I enjoyed it. Thank you so much for letting me come on and join you all.
Yeah, if you have enjoyed this episode, we ask that you please like it, subscribe, please share this with other operators, help us reach more people so that we can lift this industry that we all love so much. So thanks again, Christin, and thanks everybody for listening.